Hello everyone. Today in this lecture, in the subject of ophthalmology, we are going to discuss about the topic called as IRIDOCYCLITIS. Okay, before starting with the discussion about the topic, I hope everyone is safe and fine in Karnataka, because especially in the northern parts of the Karnataka and in some of the districts in the Malnad belt, they are suffering from heavy rain and also a condition like floods also. So I hope that everyone is fine. Okay, today in this lecture, let's start discussing about IRIDOCYCLITIS. Okay, we will discuss this topic under the following headings in this part of the lecture. This is part 1 of the lecture on IRIDOCYCLITIS. That is, we will discuss about definition of IRIDOCYCLITIS and etiology of IRIDOCYCLITIS and the clinical features, that is, under clinical features, symptoms of IRIDOCYCLITIS. Okay. Let's start with defining what is IRIDOCYCLITIS. Okay, everyone in this, by studying this medical subjects, know if there is a suffix called as itis, what it is. So the suffix itis refers to inflammation, as everyone know. Okay, we have to know the meaning of what is iridocyte. Okay, so in this, irido refers to the iris, which is a part of the human eye, and also the cycle that refers to the ciliary body. Okay, so first of all, you have to understand where exactly this iris and ciliary body comes in the human eye. Okay, this iridocyclitis comes under the pathological condition of human eye called as uveitis. Okay, so in this eye diagram, I have shown you the 3 important parts which is very important for this discussion of this topic, that is iris, which you people can appreciate over here in front of the lens, and the choroid body, which is the body which is very much responsible for the vascularization of the human eye, and also the ciliary body, which is located here, which I have marked with the red color. So these are the parts of the eye which collectively forms the uveal tissue, that is the iris, the choroid body and the ciliary body. And now the inflammation, that is I refer to as itis. So inflammation of the iris, that is irido, and ciliary body is referred to as iridocyclitis. I hope everyone is clear with the definition of what is iridocyclitis. That is, let me put it in the sentence. The inflammation of iris and the ciliary body is collectively called as the iridocyclitis, which comes under the category of anterior uveitis in the pathological condition called as uveitis. Okay, now we will discuss about etiological factors which are responsible for the iridocyclitis. Okay, the etiological factors are broadly divided into the 3 categories, that is infectious etiological agents, non-infectious etiological agents, and Masquerade etiological agents. This sounds pretty different. Okay, let me explain what exactly Masquerade and what are the agents which comes under that. Okay, now first we will discuss about the infectious agents, that is the infectious etiological cause of iridocyclitis. As everyone knows, what is infection? Infection is a tissue will get infected, some of the other organism external to the human body. Yeah, this is the general thing what we have to know, what exactly is infection, and everyone knows about that. Okay, so under the infectious agents we have mainly the bacterial infectious agents, that is the viral agents, fungal agents, parasitic agents and rickettsial agents. Okay, now we have to know what are the causative organisms under each of the things, each of the organisms which are mentioned here. So under bacteria, for example, organisms causing granulomatous inflammations like tubercle bacilli, syphilis, Lyme disease, brucellosis, these are the examples for causing the iridocyclitis under the bacteria. And also some of the pyogenic organisms like streptococcus, staphylococcus. And under the viral agents, we come across cytomegalovirus, dengue virus, herpes zoster virus, herpes simplex virus, and many more. Okay. Under fungal, we come under cryptococcosis and under the parasitic infections, we come under amoebiasis, And under the rickettsial, we come across scrub typhus and epidemic typhus. So these are some of the causative agents under the infectious factor, infectious etiological factors causing the iridocyclitis. Okay. Now we will explain about the non-infectious factors which are responsible for iridocyclitis. That is, the first one is autoimmune diseases, followed by atopic uveitis, traumatic, toxic, and finally the idiopathic. Okay, let me explain one by one. First of all, the autoimmune diseases. So under this autoimmune diseases, the HLA associated systemic diseases along with uveitis like Reiter syndrome, ankylosing spondylitis are some of the factors causing iridocyclitis, and other conditions like many other conditions cause this. And under atopic uveitis, some of the allergens like house dust, other examples like pollen, and some of the danders, these are the agents which causes iridocyclitis. And traumatic agents, this may be blunt or penetrating ocular traumas or other surgically associated traumas, like for example, surgery itself is a trauma for the tissues. So during the surgeries, the trauma to the tissues during cataract surgeries or trabeculectomy may cause iridocyclitis as a consequence. And next coming across, that is the toxic agents. So these toxic agents are divided into three categories, that is endotoxins, intraocular toxins and exotoxins. Okay. So endotoxins are the toxins which are produced inside the human body like autotoxins. Okay. So after endotoxin, intraocular toxins, that is the toxins which are produced by the eye tissues itself in cases of long-standing retinal detachment or intraocular hemorrhages, etc. And finally exotoxins, that is in case of exotoxins, the source of toxins will be from the outside the body. For example, any other diseases in the body via blood route, those systemic diseases can spread to eye and cause iridocyclitis. Okay, and after that, the last one is idiopathic, that is without any etiology, that is unknown etiology. Okay, so we are finished with non-infectious agents. And let's move on to the other thing, that is the masquerade, which we were very curious to know what exactly which is unsoundly a different word masquerade means. So masquerade is a syndrome. Okay, it is called as masquerade syndrome. Okay, a question arises in everyone's mind. What is exactly the masquerade syndrome is? This masquerade syndrome clinically presents as uveitis. Okay, which is the inflammation of the uveal tissue, that is iris, choroid, and ciliary body. But this is not mediated with immune responses. That is, there is no formation of immune complexes over here. This is called as masquerade syndrome. So this masquerade syndrome is again divided into non-neoplastic and neoplastic. Okay, now we will discuss about the clinical features in case of iridocyclitis. So today in this lecture, we are just discussing about the symptoms of iridocyclitis. What exactly the symptoms? Symptoms are these things, taking which the patient comes to you, ophthalmologist sitting in the OPD. Okay, these are called as symptoms, and signs are the things which are elicited by the doctor for coming into the diagnosis of iridocyclitis. Okay, now we will understand one by one, okay, the symptoms which are mentioned here. The main symptoms from which a patient comes to you with iridocyclitis is pain, redness, photophobia and blepharospasm, lacrimation and defective vision. Okay, so let's understand the pain. Okay, why exactly the pain is caused and what kind of pain is caused when it comes for iridocyclitis. The pain will be dull throbbing, dull aching, and also throbbing kind of pain, and the main criteria here is this kind of pain worsens at the night. Okay, and also there will be radiation of this pain into the structures called as the forehead and also the skull. These are the things which we have to know about the pain. And next, coming to the redness. Okay, why the patient complains of redness of the eye in case of iridocyclitis? Because of something called as circumcorneal congestion. So from the word circumcorneal congestion itself, we can understand circum, that is circular, surrounding, corneal, which is cornea, congestion, that is there will be congestion. Okay. So this circumcorneal congestion is mainly caused by active hyperemia of anterior ciliary vessels supplying that area. So this is the reason why the patient complains of redness in case of iridocyclitis. Okay. Next we'll understand about photophobia and blepharospasm. Why exactly this photophobia and blepharospasm is caused? It is due to the reflex between the fifth nerve and the motor part of the seventh nerve. There will be photophobia and blepharospasm. Okay, and these nerves which I mentioned now will be supplying orbicularis oculi. Okay, we have to understand here what exactly the blepharospasm means. Okay, the blepharospasm is commonly called as eye twitching. Okay, the muscles of the eyelid will be twitching. Okay, it will be under spasm. So this causes the blepharospasm. Okay, next we will understand about what exactly causes lacrimation as one of the symptoms in iridocyclitis. Okay, so lacrimation is caused due to the activities of fifth nerve and the secretomotor part of the seventh nerve resulting in the lacrimation. And the last one is defective vision. Okay, why exactly the defective vision is caused? These may be caused due to various things like formation of cyclitic membrane, corneal haze, and vitreous opacities, aqueous turbidities, etc. These are the things which causes the defective vision. So these are about the clinical features of iridocyclitis, and this is for today. So now to summarize the topic which we have discussed for iridocyclitis under the headings of definition, etiology and clinical features is, we have already defined what is iridocyclitis. It is a kind of anterior uveitis which is characterized by inflammation of iris and ciliary body. Okay, this is a simple definition of iridocyclitis. And coming to etiology, there are mainly three factors contributing for the etiology of iridocyclitis, that is infectious, non-infectious and masquerade. And I have already explained what exactly this masquerade syndrome is. And coming to the clinical features, the symptoms are pain, redness, photophobia and blepharospasm, lacrimation and defective vision. So I hope you guys got and understood what exactly I explained about iridocyclitis in this first part of video lecture on iridocyclitis. Hope it is useful for everyone. So thank you one and all.